Hey, it's Dr. Kelly with Iowa Family Chiropractic. I wanted to talk to the ladies, specifically if you're pregnant or thinking about conceiving soon, about prenatal vitamins. This is a question that we ask all of our prenatal patients. Are you taking a prenatal vitamin? And luckily in this country we're pretty well educated and we know we are supposed to be taking one, so the answer is generally yes. But there's a follow-up to that, and that is what type or what brand or where are you buying it, because it's really important that your prenatal vitamin is coming from a good place. Number one, we want to make sure it's made with whole foods rather than synthetic. If it's made in a factory somewhere, it's probably full of synthetic chemicals. And the reason we don't want you taking something like this is because your body doesn't respond to it very well. Your body will have a hard time breaking it down and absorbing it because it doesn't know what it is, because it's not food. So your body might try to push it through very quickly, or it might come back up. And this is why some people feel sick after taking a vitamin. You'll also notice in a synthetic vitamin that there's oftentimes way more than you need of a vitamin. So it might have like 8,000% of your recommended daily value of something. And the reason for that is because they have to put so much of that vitamin in there in order to get your body to absorb just a little bit, because your body doesn't absorb something that isn't food. So you want to get a food-based vitamin. That's the most important thing. The second part to that is you want to make sure it has folate rather than folic acid. Most synthetic vitamins, well, all synthetic vitamins are going to contain folic acid because that's a synthetic form of folate. Folate is naturally occurring in dark leafy greens, spinach, broccoli, things like beans or lentils. So you might be getting enough of it from your diet already, but if you're not, you want to make sure you are supplementing. Folic acid is the synthetic form. The problem with taking folic acid is some women cannot convert it to the usable version of folate, and it's about a third of the population that can't do that. So it's always wise just to say, let's go ahead and take folate rather than wondering if we can convert folic acid. Folate is a vitamin that prevents neural tube defects. So that's when your baby's brain and spinal cord is developing, and so it's essential to be taking during pregnancy, especially in the first trimester. If you have questions about your prenatal, if you want us to look at the label or make a recommendation for you, please let us know when you're in the office, or you can comment below this video as well. Thank you for listening. Have a great afternoon.